Hey team, today we're going to talk about the power of ergonomics, okay? It's Doc Bryan here. We're going to try to keep this to a 2 to 3 minute Picha review of why ergonomics in motion on the macro and the micro level are important with regards to reducing time to critical interventions, reduce providers' exposures, provider injuries, and maximize patient outcome and provider wellness. And the lawyer time. I'm not your medical director. I'm not the state medical director. Nothing I say supersedes your medical director, your SOPs, your provider level or certification. All right, let's discuss the pearls of ergonomics. Time, effort, as it relates to outcome, right? So the most efficient use of movement, energy, and time as is possible in order to maximize safety, wellness, and of course, patient outcomes. We do this both as individuals, right? Slow is smooth, smooth is fast, adherence to the basics regarding approach to problem solving, in both a cognitive and a physical manner, right? So cognitively, we have to organize and understand our higher order processing and functions and perceptions of reality as we approach any problem set, so that then we can then have the most appropriate physical posture, readiness, and movements, so that we have the most direct line problem solving, right? Ergonomics, doing the most with the least amount of energy and having then a better outcome, right? This happens on the individual micro level and macro level. So the macro level being how we approach like our monthly schedule, our 12-hour shift. These are more systematic macro levels, and also micro levels, like how we actually go through the process of a procedure, right? Like intubating or tourniquet, from soup to nuts, start to finish. So how do we streamline that process so it's the most linear, effective ergonomic process? And the main goal of ergonomics, right, is to reduce the risk of injury, so safety first, minimize discomfort for operators and patients, and improve the overall well-being, outcome, and productivity of the individual and the system and the team. As a team or organization, leadership must approach this problem of ergonomics in a keep it simple fashion, right? 2 is 1, 1 is none. Let's not do more than we need to maximize our outcome. And when you get the two together, the individual operator maximizing it, the team maximizing it, and then even look further to the macro organization trying to implement functional ergonomics, that's when we have the most optimal setting for productivity and wellness. If we think about a EMS pre-hospital problem set or call as like a terrain feature, right? We know that the best course is typically a straight line, as you see in this picture, right? The best straight line course maximizes safety, efficacy, movement, and outcomes. That's what we want to shoot for. So the most straight line that most maximizes safety, efficacy, and movement and outcomes. In other words, do the best, most effective thing for the most patients with the least amount of energy output, right? Or in other words, efficiency, use of movement, energy, time. And in studies that shows that it also improves productivity, wellness, but most importantly, patient outcomes. So things that we can do, how do we approach this, right? So one thing you can do, right, is just take a pause before a call, pause before a critical intervention, in order to think for just a moment what is the best course of action to have the best productivity, the best outcome, or ergonomics, right? So just take a pause, and what you'll find oftentimes is you take that little pause, it will increase safety, increase save time, increase productivity, and improve patient outcomes. You know, we're not talking about standing there for 30 minutes, right? We're talking about just a pause, deep breath, clarity with that cognitive perception turning into physical motion, and you combine the two to have an optimal outcome. So in other words, preparation, right? Preparation for ergonomics. Put practice into your daily routine on a macro level and a micro level. So see how efficient you can get at getting everything you need in your call notes or your run notes, your in other words, your documentation, without having too little in there to meet the metrics for your SOPs, but too much that it's taking time, and doing it in the most efficacious manner. And the way to do that is the cognitive component of it. What do I really need in my note? What am I wasting time in my notes? When am I doing this, and is it the most optimal time? And how can I create a better process improvement system so that I can do my notes in near real time, have them be more accurate, more efficacious, less time, less effort, which improves my wellness and actually improves your note taking. You also look at this with regards to doing procedures, like how do I maximize my kit setup, my ambulance setup, my kit setup, my team setup, my team cognitive and physical motions, right? In order to have the most straight line ergonomic way to put a tourniquet on, to do an airway. And when you do this, you'll find that you work better together, have less stress and better patient outcomes, and you will have a higher wellness feeling with regards to work, which, less injury and more productivity and a longer longevity in your work. So set yourself up for success. Set up your kit, your ambulance, your system, your charting, all for success, and try to approach this from an ergonomics perspective. Take time to cognitively assess how you do things, what is wasteful, what isn't, how you can combine your physical world and your cognitive perception of it in order to improve your outcomes. You'll be safer, happier, and the patients will have better outcomes. Okay, this also applies to your life, work and play. Right? If you can do this in life, especially with kids and everything else we have going on sometimes, and sometimes multiple jobs, it will definitely improve your wellness and make you a happier person that can improve your longevity. Give it a shot using our 7C method that we've discussed, and with I want you to take a hard macro approach. In other words, I'm suggesting to look at 3 things in your daily macro workflow, 3 time critical micro workflow things, like clinical workflow things. Pick 3 of them, and then actually do an active process improvement through our 7 C's to see how you can improve your ergonomics. Do it better, faster, more efficient outcomes, right? And then of course the reassessment of how that works. Suggestions might be like your tourniquet workflow, your airway workflow. On a macro level, it might be, again, how you approach your whole call from haste through end of charting, so that you can streamline it and be more efficient, more ergonomic in your movement and your charting, both cognitively and physically. As usual, we got to talk about the lawyers. So I am not your medical director. I'm not giving medical advice. We're just 2 professionals having a discussion, and it's important that we note that, given this will be open content.